Dr. Murray has spent her career serving the medically underserved. She has worked in a variety of settings, including practicing occupational medicine at a workers' clinic in Canada, residency director for occupational medicine at Meharry Medical College, and bureau chief for the Chicago Department of Health under Mayor Harold Washington. Dr. Murray worked as a medical director of the federally funded health center Winfield Moody, serving Cabrini Green Public Housing Project in Chicago. Dr. Murray has been an active member of a wide range of local and national organizations, including serving as a member of the Board of Scientific Counselors for the Agency for Toxic Substances and Disease Registry, and the Board of Scientific Counselors for the National Institute of Occupational Safety and Health, and the Board of Directors of Trinity Health. In 1997, Dr. Murray returned to the Cook County Health System, where she served as Chief Medical Officer, Primary Care for the 23 primary care and community health centers comprising the Ambulatory and Community Health Network of the Cook County Bureau of Health Services, and as an attending physician in the Division of Occupational and Environmental Medicine at Cook County Hospital. Dr. Murray has worked in leadership roles in many public health organizations, including the National Association of City and County Health Officers, Health Equity and Social Justice Team, the National Executive Board of APHA. During 2011, she served as president of the American Public Health Association. In December 2014, she retired from her position as the chief medical officer for the Cook County Department of Public Health of the Cook County Health and Hospital System, the PHAB accredited and state certified public health department for suburban Cook County. In December 2018, Dr. Murray stopped seeing patients as a voluntary attending in internal medicine, ending over 40 years of clinical practice. Today, she serves as an honorary attending of Cook County Health and is an adjunct assistant professor at the University of Illinois School of Public Health. She serves on many local and national boards, including the Chicago-based Health and Medicine Policy Research Group, and chairs the board for the National Collaborative for Health Equity. She remains passionate about increasing the number of Black and Latinx health professionals and serves on the Urban Health Program Community Advisory Committee at the University of Illinois. Dr. Murray is devoting the rest of her career to being an enthusiastic, full-time troublemaker. She has been a voice for social justice and health as a basic human right for over 50 years. Thank you so much for joining us today, Dr. Murray. We're so honored to have you.
Oh, it's my pleasure to talk with you all. And, I have a limited time. Let me just say, I've already sent these slides to Marvin, so hopefully he can get them out to everyone. And also embedded in the slides, I will be going through these very fast. Embedded in the slides are some suggestions for books, which I usually won't spend a lot of time talking about, but when you get your slide deck, you'll be able to see them. So let me say that, the topic, and I know that you've had Dr. Rogers talk to you about racism and structural racism. And the topic that she and I were given was talking about how racism makes health inequities worse. And what I'd like to do today, especially since you all are generally M1 and M2 students, I'd like to spend some time today so that you can approach the concept of health equity, which is like an in thing nowadays, but it's an important issue that's been there for centuries. You can approach it with some critical eye and spend some time integrating readings about it in your schoolwork. So I don't want to just routinely do the land acknowledgement, but I do want to make a note that we ought to be doing it, but more importantly, we ought to be thinking about what it means. And later on, we'll talk a little bit about Native Americans. So one of the problems we have in this talk is if you spent your whole program on health inequities, it still wouldn't be enough time. So it's a silly thing to do. But let me just say, here are two good books that you ought to look at that look at the theory of epidemiology by Dr. Krieger. I'll leave you to that later. And I will talk very little bit about the Latin American approach. So let me say this way. How we even think about science in the Western mindset lends itself to racism. And because racism as an ideology, white supremacy as an ideology, is so integrated not only to our economic history and our social history, but even to how we think, quote unquote, scientifically, and what we think science is and what it is not, that it's easy to be blinded by it and not understand that. The Latin American movement for social medicine and our Latin American colleagues in epidemiology are, I think, in my opinion, the most advanced in thinking about these problems and challenges. So here's a book that, if you're like me and illiterate in Spanish, here's a great book in English by one of the leaders of that movement, Jaime Burrell, that I want to recommend to you. If you don't have time to read that short book, the article is listed there. So I think if we start off by what do we think health is, this comes from the People's Charter for Health, the preamble of the charter. If you're not familiar with that, Google it up. But I think this, in fact, fits my definition of health. Health is a social, economic, and political issue, and above all, a fundamental human right. Inequality, poverty, exploitation, violence, and injustice are at the root of ill health and the deaths of poor and marginalized people. Health for all means that powerful interests have to be challenged, that globalization has to be opposed, and that political and economic priorities have to be drastically changed. This was true in 2000, almost a quarter of a century ago when this charter was started, and it's even more true today. So these, however many there are, 7 or so American values comes to us from Dr. Jones. I don't know if is she speaking to you all at all? Yes, no? No? That's too bad, because she would be a great person to speak, but in any case, and she picks these out. Let me just say, these are not the only American values that exist, but they are fundamental to how our country is set up, and they are some of the major reasons why we have obstacles in doing something simple like universal health care for all. We focus narrowly on the individual. As Americans, we have a completely ahistorical stance. If you travel around the world, you'll realize that many other countries and cultures, including Europe, have a much more historical view that's baked into sort of the average citizen. In the United States, we promote and we are the major guardians of a white supremacist ideology. This has been true historically. We believe in the myth of American exceptionalism. And let me say that we believe in the myth of an American exceptionalism as though American were good. We might be exceptional, but not necessarily in that direction. We believe in the myth of meritocracy, that if you merit, you're rich because you deserve to be rich. We believe in a zero-sum game. That's why elderly people were fussing during the last several elections that the government should keep their hands off their Medicare. And we don't think a whole lot about the future as a culture. So I will refer to this later. I just put it up here to remind you this notion of what causes health inequities is something about which there's a general consensus certainly in the public health community globally. This happens to be a model about social determinants of health writ large in the WHO world. Let me just say how Americans, when I was in medical school many decades ago, social determinants of health was not a gleam in anyone's eye. Today, every right-wing motherfucker talks about social determinants of health, but people actually, Americans in general, even in public health, we misuse this. So social determinants of health, as you can see here in this WHO model, it's this little nice blue block here. They are really intermediary factors. They're not root causes. They're not structural issues. They're intermediary factors, or whether you're poor or not, and that kind of stuff. What WHO tries to concentrate on here is sort of the yellow and orange part of this diagram, the structural determinants of health and health inequity, starting with the social political context. What kind of government do you have? What kind of big policies do you have? The social hierarchy becomes important, and what class you're in, how much education. All these things are critically important even in the WHO model. That's a consensus model. That's not a left-wing model. In fact, I have many disagreements with it. It's a basic consensus model of public health today. This is the model that I prefer. I think it makes sense. This comes to us, and it's been developed over the past quarter of a century by Nancy Krieger, who is presently at Harvard. And I like this model, especially for Americans, because it puts in there stuff we often forget about. She argues, and I agree with her, and in general, people agree that class injustice, race and ethnic injustice, and gender and sexuality injustice, these are the 3 major categories around which power, privilege, resources are structured. And if you ask yourself what makes people sick and some people not sick, what allows people to be healthy, we would argue that how we organize these 3 major things in this present period in history is the key matter. Her motto looks at life course, which is always important. If you start your life off poor, you're in trouble to begin with. She does think about the different levels that we talk on. This can operate on an individual level as well as obviously on a global level. She includes important concepts here that we don't have time to fully discuss today. But just to let you know up front, which is why I suggested those books earlier, this is eco-social theory that I think makes the most sense to explain human health, just so you know ahead of time. This is a Dr. Jones, who has spent the past decade or so thinking about and talking about racism. If you haven't had a chance, if you're not going to have her, you should Google some of her talks on YouTube, because she really gives you some tools that you can think about. But she argues, and I agree. Now, let me just say, in medicine and in public health, we are dumb about social conditions. And so we are not the most important thinkers and the most advanced thinkers on this issue. But she is a physician, and so it's easier for us to, she talks our language. So she argues when you think about racism, you have to think about it as a hierarchical system that unfairly advantages some people and unfairly disadvantages some people and messes up the whole society. That's her basic definition. The key thing that we often forget is that it unfairly advantages some people. Anti-Black racism plays a special role in human history and a special role in our country. But it's important to understand that racism is not a binary issue. It's not a Black versus white issue, which is how we tend to think of it in the United States because of the history of our country, even though we don't know our history, so it's a bad way to think about it. But the rankings of people who are not white, people of color, change over time and place. And who is white in the context of Europe, and certainly in the context of America, also changes over time and place. So you really have to be careful how you think about racism and how you compare things. I know that Susan gave you a definition of structural racism. Let me just be honest here about this. There's lots of discussion recently in the medical literature about understanding structural issues. I'm not sure that how we've been using that in the medical literature makes sense with everybody else. So I don't want to comment on that. It's a nice thought. But to talk about what we think are structural in a society, underlies that is a theory. So many people who use this language are building it on basis of Marxist theory. There are other theories that it's built on, but just be clear, just because you say something is structural, you really have to understand what does that really mean. For us in medicine, I think we can say easily, without spending too much time on all the different theories, that it helps us understand the racial legacy of our past. And it helps explain or forces people to think about how those historical legacies persist today, and how it gets transmitted generation to generation. I personally believe, I will not suggest this is a dominant belief, but it is not my personal invention. There are many of us who believe this. When I was a young college student, this is how we talked about it. I believe that racism and capitalism cannot be separated. And in fact, I like talking about the concept of racial capitalism, even more than just capitalism or racism. This is a quote from Du Bois, and I know Susan mentioned one of his books. I saw it in there. I'll probably do it again. But this, I think, is critical to understanding. So this book was written decades ago by, I think, the greatest social scientist America has produced. Black labor became the foundation stone not only of the Southern social structure, but of Northern manufacture and commerce, of English factory system, of European commerce, of buying and selling on a worldwide scale. New cities were built on the results of Black labor, and a new labor problem involving all of white labor arose in both Europe and America. This is from Black Reconstruction. So he's really arguing here that you cannot think about the modern world without understanding the role that racism played in that, and how that ideology, that there's a hierarchy among human beings with the whites being on top and therefore being allowed to exploit everybody else, that's critical to understanding how the modern world was built. There's another article underneath there that you can look up that is in the public health literature trying to talk about racial capitalism in terms of understanding our response to COVID. Here's Black Reconstruction. If you didn't have a chance to read it when you were in college, it's worth going back to read, especially nowadays as we are about to enter a new stage of American history. We'll talk about that later. The middle book is a great book too. It's a slower read, but this is Nell Painter, one of our historians. It's interesting to me because when we think about racism, we talk a lot about racism and understanding the history of people of color. But how can you talk about racism if you don't understand the history of white people? Okay, so I encourage you to read that book. And Slavery by Another Name is also a great book. You can ask me about it. Here's two other great books that, as I said, it's not a black and white issue. So here are two other basic, simple books written relatively recently that will help get you squared away. I'd like to start with this question, though. Could you starve to death in England in 1939? I mean, sorry, 1839. I'm sounding like Biden here. In 1839. What do you think? You can unmute and say what you think. What do you think? Could you starve to death? Come on now, all y'all finished 1 year of medical school. This is an easy question.
Yes.
I think yes.
Okay. So all of you all are answering that in 2024. The scientific question, that is to say, the scientific accepted answer that has determined what you're studying in medical school and what we teach in public health was no. Now, this is 1839. So think about that for a minute. So how did that happen? What are we talking about? This is a famous debate. Let me just say in the beginning, which is another important thing that I want you all to not be disturbed about. Neither one of these gentlemen, these white gentlemen, Edwin Chadwick or William Farr, neither one of them were evil, okay? And whichever one you think was right in this debate, there are other debates that happened in that time that they took different positions on. These are two leaders of modern public health, especially, obviously, the British American tradition, and two leaders of modern medicine. Well, at least Farr was a bit. Chadwick, as it says here, was a lawyer by training. William Farr was a physician by training. And the problem was, and this becomes critical when you think about how we teach stuff, is you have to ask what's the question? And where did the question come from? And on what theories are based our approaches, our clinical approaches, our treatment approaches. So Chadwick he was a lawyer, he was trying to set up vital records information. You can't really make progress on population health if you don't know what's making your population sick. You know, so he's trying to establish, well, what's really going on? What's really impacting, in this case, the lives of people in England in 1839. William Farr is a traditionally trained physician of his era, and he was actually, during this debate, working for Chadwick. Chadwick sort of was in charge of the national effort to keep track of these basic vital statistics. William Farr was out in one of the provincial areas reporting in, you know, I had 50 people die of this, 30 people die of that, so they could collect the information. Chadwick was asking what disease, and Farr was asking what are the causes of disease. Now, since we don't teach you any history of medicine, which ought to be the first reason you ask for your tuition back, how the hell can you go to medical school and no one explains to you the history of medicine? It's really amazing to me. But anyway, so let me tell you some of the history of this time. In 1839 or 1840, it was an economic depression. There was a lot of social unrest going on in England. You know, this is a decade before 1848, when you had all kinds of revolutions and unrest going on all over Europe. But there was social unrest in England. And in 1834, right before this debate broke out, there was, and Chadwick was critical in this, there was an amendment to the Poor Law passed in 1834. And from Chadwick's point of view, this solved the problem of the poor. If you were very destitute in England, you could go to workhouses, you would be fed, you had some place to say, think about Charles Dickens, okay? In A Christmas Carol, right? Remember when they asked Scrooge, Scrooge says, "Well, can't they go to the poorhouses? Why do I have to give money?" So think about that. And in fact, the Dickens work gives you a good idea of what was going on in London at this time. Now, it should not surprise you. We have the same issue today with people who are unhoused. Most of the poor hated this law. One of the reasons they did is because you couldn't live there as a family. I know in Chicago, I don't know where you all are, but in our shelters, you basically can't go in as a family unit. Maybe a mother and young children can stay together, but and these workhouse diets were really horrible. And the London Times labeled them starvation diets. So this was a controversial law. But from the point of view of Chadwick and many people in the upper classes, this was a generous offer and helped solve some of the problems. So these are the ideas that they both had. Chadwick is part of the sanitary movement at this point. So again, why did people get sick in 1839? There were theories. One of the theories was, this is before microbes, okay? Microbes did not exist, all right, in England in 1839. But the feeling was that sort of toxic fumes from filth made you sick. And Chadwick was part of a movement. We need to be very specific about these diseases. And he did not like this notion of starvation. Farr, on the other hand, was a traditional doctor. What did that mean then? The notion of what doctors thought in these 1800s is about to change to what we do today. But they really thought about causes of disease in a much more broad field. And so Farr's position was he's counting diseases, and he said he labeled, you can see there's 63 of 148,000 deaths due to starvation. Because he said medical men know that if you're hungry, if you're chronically hungry, in other words, if you're malnourished, if you're chronically hungry, then all kinds of shit happens to you because your constitution gets frail. If you work too hard, if it's too hot or it's too cold, and you don't have enough nutrition, you just can't function in a normal way. And little things, again, remember, nobody knows about microbes. Little insults that normally you could fight off, you can't do it. And so in the mind of many physicians, starvation, chronic, not enough food, could make you sick and eventually kill you. Chadwick saying, oh, that's not good enough. First of all, we have this new law. So if you're really hungry, you can go to the workhouses and you can get food. But secondly, he went in detail in these 63 deaths. He said 36 of these deaths were infants. So you're talking about either women didn't know how to breastfeed. Now think about this. Poor working class women did not know how to breastfeed. This is what Chadwick said. Only a man would say that, right? Poor working class women did not know how to breastfeed. They're ignorant about what you have to do to feed an infant. Some of these kids died because they were cold. So he really is saying these are not good reasons. We have to, just saying starvation is a social reason. So this is what Chadwick is really saying. This is a social cause. It's not a, he wouldn't have used the words biological cause, but he would have used the word specific cause. Now, let me ask you this. At this point in history, and certainly for decades after that, one of the biggest causes of death or even sickness for women was hysteria. For white women was hysteria. Okay, this was considered a legitimate cause. So again, these causes of death are always socially determined. We're still having debates about this. For most of human history, if you got sick, and especially if you died, you had angered some god or some ancestor or something. Malnutrition, the answer was no in 1839. But air pollution, for example, was not listed as a cause of death in the United Kingdom till 2020. Racism is still not listed as a cause of death today, anywhere in the world that I'm aware of, but certainly not in the United States. Police violence, until very, very recently, was not listed as a cause of death. Voting suppression. So you could think of lots of other things that one could argue impacts health in a negative way that we don't consider in our allopathic medical model of what causes of death are. So this is a summary of some of the Western scientific assumptions that we routinely make. This requires a whole course in metaphysics, and we don't have time for that. But let me just say, we have this notion, Lacanian notion, that science is neutral and objective and should not be political. I don't know where the hell that comes from, but anyway, that's an assumption that many people argue about today and still think is true. We have this Cartesian notion that any system that we can completely define by taking it apart, then we fully understand that system. This is another strange light fantasy. But anyway, that's another assumption. We also make an assumption, we don't necessarily verbalize it, that if two things are dissimilar, that's the same thing as being unequal. And there's an implication there that if two things are dissimilar, one of them is better than the other. The notion is if you can measure something, if you can attach a number to something, that assumes that it's neutral and objective. And then in typical human arrogance, we conflate what empirically happened with what was historically necessary. So slavery empirically happened, it must be historically necessary. So these are some basic scientific assumptions that I think is not the only way to do science and certainly not the only way to think. I want to take a minute to talk about Virchow, one of my heroes, one of my white men heroes. I don't have a lot of heroes that are white men, but I have a few, and this is one of them. This is a famous quote from his: "Do we not always find the disease of the populace traceable to defects in society?" You'll find Virchow in your pathology, in the footnotes of your pathology book. He's the father of microbiology. He was on the medical faculty of Berlin. He's a pioneer in virology. So it's with him that we begin to explore microbes. They begin to come into our notions and way of thinking. He actually discovered and documented the pathophysiology of trichinosis and forced, and more important than that, forced compulsory meat inspection in Germany. He designed and supervised the Berlin sewage system. Now think about this. This is the father of microbiology. He never accepted the simple causal relationship that we see in conscious postulates between bacterium and disease. He thought that was too simplistic and did not fully explain anything. Think about tuberculosis as an example. He believed in providing medical care for people that were indigent, including the free choice of physician. He wanted to prohibit child labor. He fought for protection of pregnant women. You can see the reduction of hours. So he's a great guy in occupational medicine. He got suspended from Berlin's medical school as the pathology chair. They had to bring him back. He was politically active, as you can see. He fought against the increases in the military budget and therefore was accused of being unpatriotic, and he refused to be knighted. Great guy. Here's another quote of his that I like even more. Medicine is a social science, and politics is nothing else but medicine on a large scale. Medicine as a social science, as a science of human beings. So this is very different than how we think of medicine. We tend to think of it as a biomedical, technical, automatic, machine-like thing. But anyway, medicine as a science of human beings has an obligation to point out the problems and to attempt their theoretical solution. The politician, the practical anthropologist, must find the means for their actual solution. The physicians are the natural attorneys of the poor, and the social problems fall to a large extent within their jurisdiction. This is in our lane, young doctors, if you understand our history, even our white man European history. So let's get back to racism for a moment. There are two notions about this hierarchy of human beings. The first is whether, the question is, are humans all coming from the same origin? Are we all the same species? So a number of people felt that we weren't from the same species, okay? Human beings were not from the same species, and this is used to defend slavery. They did not believe we had a common ancestor. Monogenism, they did believe we had a common ancestor, but mostly because of the Bible. So we need to be clear, this is not, so that's another thing. When you look at scientific fights or historical fights. You have to try to understand all the diverse opinions that existed, but also try to understand how they're defining things. So what the apologists, and I'll talk about one of them in a minute, argued is there's no proof that we all had the same common origin. As this slide says, it's really not to the 1980s that proof gets confirmed by our technology and ability to look at DNA and mitochondrial DNA particularly. And it was mostly based on this biblical assumption. There's a long history of racist and racism. I don't want to talk about that today. I just wanted to bring up Blumenbach, who was involved in trying to describe human variation. So that people start off trying to describe human variation. Why do Irish look like this and Italians look like that and Ethiopians, so they start just trying to describe the variations. The notion of putting hierarchy on that variation, that's not inevitable. Blumenbach is a well-respected German in this area. You can see the 5 races he puts over there on the right column, but he felt that there was no hierarchy in these races, and that skin color, skull size, all that stuff was just data points. It didn't have any deep meaning. And he specifically said that even the, quote, lowest Africans could produce people equal to Caucasians. So he's an early anthropologist that's not based on a racist ideology. He's just describing he did not like slavery. He argued against it. And again, this is another thing to remember. When you look at these early racists, they don't know shit about genetics. And even the little bit that was that was postulated, they forgot. So this is a time period where they didn't have a mechanism to explain these differences. He was an anatomy professor, again, a father of physical anthropology, but he disagreed that Blacks were mentally inferior. And here's just a list of people you can see from the different leaders of the time that said, you cannot defend human slavery based on this nonsense of human variation. So you can see everybody from Marx, Gruber, all these people who are saying, this is Blumenbach. He's pointing out, even though we have these differences across the world, you can't assume hierarchy based on those. Which is the other thing you ought to remember. At every point in human history, no matter what the dominant thinking is, there are always people that disagree with it. And so one of our tasks as critical thinkers is to find those people and find those readings and think about them. So again, just a brief note. This is another thing about how we don't know any history. I want to remind people there was a trans-Pacific slave trade. Most of those slaves, you can see here how it's organized. Most of those slaves did not come to the British colonies, which is why as Americans, we never talk about it, never think about it. And most of us are ignorant of it, but it existed. It was massive. And it impacted Mexico and South America far more than the United States. Here's a look at the transatlantic slave trade. Every time I ask people about this, I don't care whether they're historians, I don't care if they're Black historians. Most of the time, as Americans, we can't answer the simple question: where do most African Americans come from? Where do they live? Where do they come from? And never in my many decades of asking this question, even in all Black audiences, never has anyone got it right. But this map, even though people have seen this map forever, this map gives you a rough idea of where different slaves landed in the transatlantic slave trade. And I think this is a conservative map, but you can see not even 500,000 ended up in the British colonies, this in the United States. But you can see wherever else they went. The biggest number went to Brazil. Some went to Europe. So most Africans stolen in the transatlantic slave trade, only 4%, 3%, 5%, somewhere in there, ended up in the British colonies, and the 90% plus ended up in the rest of the hemisphere, the Caribbean, Mexico, and South America. And that bar graph there gives you an idea just in terms of how many years. So still 61% of the time in British from 1619, again, that's not really historically accurate, but it'll do for now. So from 1619 till the Civil War, till the emancipation, you're talking about 61% of the time in the United States. Then another quarter, 25% of the time in the United States under what I call terror and Jim Crow. And so, again, another artificial demarcation, but if you want to count from 1966 during under neoliberalism till today, only 14%. So actually, the vast majority of African Americans don't live in the United States, and we speak Spanish and Portuguese. Another way to think about it is the vast majority of African Americans of slave ancestry, the vast majority, not all, are Latinx. Think about that. So here I come to Dr. Knott, a great and important American physician, our elder and ancestor, if you will, professionally speaking. You can see when he lived, he was a physician and gynecologist. He did major and significant research on yellow fever and malaria. He formed the first medical school in Alabama. He was the medical director of the Confederate Army. Gives you a clue where he's coming from. He was very thoughtful about race and issues of the day. In his mind, the Negro races stand at the lowest point in the scale of human beings. It is clear they are incapable of self-government, and that any attempt to improve their condition is warring against the immutable force of nature. So he's not even typical. I shouldn't say that. He is one of our outstanding American physicians, representing those who supported slavery, which all people didn't. All physicians didn't do that, but most of them did. He didn't do this work. This comes to us. You can look this up if you want. If you Google this at the bottom here, in 1849, 10 years after you couldn't starve to death in England, this is a report that Pendleton makes about the diseases of Hancock County in the Southern Medical Journal. There was no such thing as peer review in those days, but this is a well-established, prestigious journal, the Southern Medical Journal. And they just gave a report for that year on deaths, just like we talked about with Chadwick and Farr. They didn't do charts in these days. The first person to do charts really in any big extent in the United States was really W.E.B. Du Bois. That's another story. But they did describe this, and they had a table of data. And so this is the problem with this data. That prevalence is actually inaccurate. It was really percentage, but we'll leave that alone. So diseases peculiar to women are just generally disorders of the reproductive system, more or less. And then they specifically called out miscarriages. Okay. And the tall blue bars are the percent that they saw this among women who were enslaved. And the red bar are the percent prevalence among white women. And the reason why I put this up here is because this is not what they expected. This is not what science would lead you to expect. And if you read this little stuff, it's very interesting. And I encourage you, when you have time, to always try to look up the original stuff so you can see it. I'll give you some quotes in another slide or two. But when you read this stuff, you can see them thinking about this. And they're saying, like, well, wait a minute. Enslaved Africans are strong. They are built for heat. They are built for work. We're not being mean to them because this is what we were made for. But how come they're getting sicker than white women? So this was a problem. This didn't make sense in their theory of what caused disease. In other words, this inequity that we see, this disparity, is this because of conditions of slavery or because of the constitutional conditions of the enslaved? This question, just like this, is asked every single day in modern medicine and all through our history. Is something wrong with the person we're looking at? Increased lung cancer among Black steel workers, or is there something wrong with the steel mill? And these are direct quotes from our guys. Let me move your pictures out the way so I can see here. So this table, I love the way they frame this because they are using modern scientific language and thought processes. And don't be biased because you think you know better than these people in 1840 what's really going on. And of course, none of us are racist. So what they're saying is this table of data either teaches that slave labor is inimical to the procreation of the species. So think about this. So here's a perfectly reasonable hypothesis that they're not stupid, they thought of. And they were even had some ideas why. It hurts people through exposure, violent exercise, etc. So they have a plausible hypothesis as to why that graph exists, or as the planters believe, in other words, the slave owners believe, that blacks are possessed of a secret by which they destroy the fetus at an early stage of gestation. So they have two possible explanations for this data that contradicts what they think, how they think the world works. And they have a discussion section and something, and they say, in philosophizing on this immense difference, we are led to the conclusion from the facts within our knowledge. So you see how they're hedging themselves within our knowledge that it originates from the unnatural tendency of the African female to destroy her offspring. This is science. I won't bore you with all the things that we talk about why there's more infant mortality today or why different things happen. And so thinking about what science is important. I think that science is a social institution like all the other social institutions, and you have to be aware of what's going on. The notion of saying that police violence and murder by police is an important issue that we need to think about. Before George Floyd, it's been going on for hundreds of years in the United States. I will tell you, excellent academics that wrote perfectly competent papers, none of these papers gets published until recently. Okay, they would send in papers about deaths from guns, deaths from police, and the journals would just say, we're not interested in this. This is not in our area. So what science gets published, what science gets researched, what science gets funded, what science gets published is socially determined. So we have the institution of slavery in the United States. We have a nation built on genocide for our indigenous populations and importation of free labor from Africa. We're already far into our history here in 1830, but just to remind you that in 1830, we see the Trail of Tears, which has to do with the movement of indigenous nations from the southeast part of our country, west of the Mississippi. Why? To free up land in Mississippi and Alabama for plantations to expand and get settled. This is just showing the Trail of Tears. Lots of people died on the trail, but it shows you the movement of a number of indigenous nations, and also explains why Oklahoma really belongs to the Native Americans. That's another discussion. But what I really wanted to say with the Trail of Tears is that then you see, starting early in late 1700s, you see a domestic slave trade, larger by far than the transatlantic slave trade. The domestic slave trade goes on before the end of the transatlantic slave trade, but it's clearly cheaper and safer to transport slaves from the East Coast west than to try to bring them all the way from Africa. So we had significant numbers. People are roped together. I have some family friends who were able to trace enough of their family history that they can trace their family from being in an East Coast plantation and being marched west to Mississippi and settling there. So we're talking about 1.2 million people sold in domestic slave trade, far more, 3 or 4 times more than the transatlantic slave trade. There's some estimates that 40% of slave families were impacted by this. 40% of people who were enslaved had members of their families sold off during slavery. Think about the impact of that on a population's health and sense of history. And again, since we're in election periods, just to do some basic Reconstruction math, whether you're talking about, I guess I don't have a picture of slavery on this. I do have a picture of lynching. This picture in the bottom here is actually from Chicago in the race riots of 1921. But anyway, just to remind you, the 13th Amendment, which abolishes most of slavery, it's important to remember, it doesn't actually abolish slavery. It just says you can't have slavery except as punishment for crime. And it also says that the Congress could enforce this 13th Amendment, which it tried to do with a number of like the Civil Rights Act of 1866. That's another thing. Be very careful how we talk about stuff. The 1960 Civil Rights Movement, incorrectly typified as sort of King's era, that was not by any chance the first or even the second civil rights movement of African Americans in this country. But one thing I want to point out, which is why we are in trouble today, the Electoral College is profoundly undemocratic. The 3/5 rule just allowed the white plantation South, at a time when only landowners could vote, white men who own land could vote, but it allows them to have more power than they should have had, because they counted the enslaved people as 3/5 of a person, even though they were treated like horses. So, but after the Civil War, so think about this: you have part of the country secedes during the Civil War. You have this massive war that kills more Americans than all of our other wars combined. And then the Southern states rejoin the Union, and they now have more power, more voting power in Congress than before they seceded. Why? Because you've now said that Black people, former slaves, are a full person. So basically, their representation went up by 20%, 40% right away. And never was their voting power threatened, even though they never really, except for a few years, allowed Black men to vote. How did this happen? So this is the structure. If you don't pay attention to the details, then the structure is often unseen. So what happened during so-called Reconstruction? Well, many things happened. I'm sure you've heard about the compromise and all that kind of stuff. But what really happened right away is you had, in general across the South, you had strict vagrancy and labor contract laws. So one minute you were a slave, the next minute you weren't a slave, but you were required by law to have a contract, and to have a contract at least for a year. And you couldn't switch in the middle of the year. People were not allowed to offer you more money. So if you agreed to work for somebody for $10, somebody couldn't come along and say, well, work for me for $12. That was not allowed. And this is the major mechanism by which labor was obtained in the South. So it's not just that if you robbed a store and you got put on a chain gang. No, if you didn't have that written contract, then you were in trouble. Even, now we've made Juneteenth a holiday. So again, usually people would say, and this happened in Texas, you're free, but you need to go to work for this man that used to own you, and just chill, stay and work for him. So these kind of anti-enticement measures, this enforcement of these contracts, are some of the ways in which slavery was not really ended in the United States. This is where, so when people talk about structural racism, they often go back to redlining and stuff. It goes back farther than that in terms of where you were allowed to work and how often you were allowed to work. At the same time this Reconstruction was going on in the United States, in the Southern and the old Confederacy, you have the nation expanding, and you have Mexican Americans being lynched. So after we capture the northern half of Mexico, northern third of Mexico, during that same period, you have fights over land, not just Indian land, but land that, and don't forget, these are other settlers now, land that the Spanish colonized and set. And Mexicans and Mexican Americans were being lynched at the same rate as Blacks. We'll have a book later that talks about this. This didn't get the same publicity. Blacks and Mexicans were not the only people being lynched. The biggest group of people that got lynched in one time that I'm aware of are Chinese in LA. But Native Americans were lynched. Poor whites were frequently lynched. We don't know about this because the NAACP, being a Black organization, the way they documented lynching was they would have to read the local newspapers. which were in English, and they would read them and they would hear, oh, here Johnny got lynched, and they would count it in their New York headquarters. They didn't read Spanish in general, and they didn't look at the Spanish newspapers. Later, some Mexican American historians looked at the Spanish papers, and that's how we know that we're talking about the same kinds of numbers in terms of lynching. Um, Here's another great book in terms of public health and race in LA, which begin California is a good example, because then you begin to see Mexican, Japanese, Chinese immigrants. You begin to see the racism existing beyond just former slaves. So that's a great book. Both of those books are good. Most of you have heard of the Chinese Exclusion Act. It's one example of racism against Chinese and other Asian groups. This is like a great summary of our history. I love this cartoon. So here you see in the back, you notice they're all looking white. These states get added, by the way, and generally speaking, these states were not allowed to be added to the Union until they had enough white people in them. So if they didn't have enough white people and the population would be predominantly non-white, they didn't win their way into the Union. So here are our colonies. Even though we don't consider ourselves an imperial nation, we could spend days on each one of these. Cuba, Philippines. What we did in the Philippines is horrendous, but anyway. So here are the imperial nations that we began to expand to. I want to point out that the Native American here is sitting with a book upside down. These cartoons used to be so true. We're much more careful nowadays. So here's a Native American. Here we are on his land. He's reading upside down. Here's a Asian, not even allowed in the school. Okay, and here's the former slave washing the windows. So I just think this cartoon says it all. We had the internment of Japanese Americans as part of the war in California only. So 120,000 were incarcerated on the West Coast. In Hawaii, where 1/3 of the now think about this. Here's Hawaii, much closer to Japan. 1/3 of the population is of Japanese ancestry, but there was no big concentration camps in Japan. Okay, it has something to do with power anyway. So here's some other books. The only one I want to point out to you, well, this is the one about lynching. This Ron Takaki is a 1960s kind of historian. There are more recent books on the history of Asians in the United States. This is a classic. I think it's a wonderful book. Start there. Again, we revere Harriet Tubman, but the Underground Railroad didn't just go north, it went south. So you have lots of slaves running to Mexico and south in the Caribbean. And this is a great book on the American Empire. So here's some other books. Let's see how much get my time right. On Black health, the Masters of Health here, sort of in the middle, talks about some history of racism in American medical schools. It's a relatively recent book. The rest of them are classics. I don't want to spend a lot of time on this. These are people you study in Epi. It'll be on boards part 1, but they don't tell you the real deal about them. They were both racist, Galton here and Pearson. So anyway, look up this article when you get a chance. This is only from 2016, not that long ago. Here are first year, second year, and third year medical students in that last column on the right are residents. And this is looking at biologically racist notions and how many students still believe this stuff. I wanted to take a minute on maternal mortality because in the past 2 or 3 months, there have been some papers, well-written papers, that show that we've overestimated this. This often happens. That's the other thing. We throw around numbers as though it represents some truth. We rarely talk to students about what these numbers are based on. So what happened with maternal mortality is we changed how we coded stuff. We changed some definitions. So you really have trouble comparing the data historically. It does not mean that there's not a disproportionate increase or in maternal mortality. It just means you have to be careful and you have to understand what's really going on. And so this maternal mortality that we have as a country is stratified by race and ethnicity, with Black and indigenous having higher rates of maternal mortality. And also, this is calling out Fannie Lou Hamer. From though you're too young for this, but she was a leader in the Mississippi Freedom Democratic Party. But she was a victim of the Mississippi appendectomy. If there was any reason in the South for a Black woman to have any kind of abdominal surgery, it might have nothing to do with reproductive matters. If they had a chance and they went in there, they just did they did a tubal ligation, so that they couldn't have children. And they often didn't inform the women that they did it. So Fannie Lou Hamer is one of our leaders that had that done to them. California actually sterilized the most women, mostly Mexican Americans. But this is all part of, so this is again 1907 to 1963, where the eugenics movement, this was not some minor fly-by-night thing. This was science at its height. The eugenics movement was science. People talk about scientific racism. Well, it was it was scientific racism, but that's still science. Some of our science is still racist. In any case, you can see how many people were sterilized. For Puerto Rico, these are the young lords from Puerto Rico, Puerto Rican freedom fighters. Forced sterilization of Puerto Rican women was a real problem. Forced sterilization of Mexican American women, forced sterilization of Blacks. Here are two physicians that, again, we don't teach about, but we should. Constance Redbird Urey, who was a Cherokee Choctaw physician, she estimated and wrote papers in the 1970s that some 40% of Native American women where she was working were sterilized, and 10% of Native American men were sterilized. And Helen Rodriguez Trias, a Puerto Rican pediatrician by training, that was really one of the leaders in terms of reproductive rights, talked about a situation where 1/3 of women on the island were sterilized. This is the place where we did the clinical trials for birth control pills. And this is still going on today, so I forgot what year this is. This is 2020, I think, where you have women in our ICE detention camps. This is Dawn Wooten is a LPN by training, but she knows about the history of sterilization, and she blew the whistle where women from the ICE camps were being sent to local OB-GYNs, again, for some problem having nothing to do. They weren't trying to get sterilized, but given an opportunity, he would just sterilize them. So this is still a problem. So when we think about our anger about the reversal of Roe, we should remember Roe never guaranteed reproductive rights for American women. It never even guaranteed equal access to abortion for women. There are many, many, many women, poor women, depending on what year you're talking about, Native American women, federal employees, who were not able to access abortion health services. And so it's important to understand, well, what did women do in those times? So women of color especially talked about reproductive rights, not simply the right to get an abortion, the right to be able to produce children or not produce children, depending on what you wished. Another bunch of great books. This one here in the middle here, Body and Soul, is a great book about the Black Panther Party, but all these books are great. When you get a chance, look them up. And I want to end real quick with the Tuskegee study. This was not a random evil study that people just didn't know. This was based on racist science that was dominant for the time period, because we had a biological reason why syphilis appeared the way it did. It had to do with the inferiority of Blacks, not only the biological inferiority, but the moral inferiority and all of that stuff. Blacks were innately prone to syphilis according to medicine, American medicine. There were differences in syphilis. So cardiac syphilis was high in Black, neurosyphilis was low. Why? Because they felt neurosyphilis, Blacks were too dumb to have neurosyphilis. I hate to say it that way, but that's what they thought. And so this argument about the nature of syphilis, they were really looking at some of the more interesting sub-hypotheses. It's not like they were saying, oh, what's going to happen if we don't treat them? No, they were trying to track neurosyphilis versus cardiac syphilis and all these other kinds of things. Still a racist study. It's important to understand. William Hinton is one of the African-American physicians that worked in the area of syphilis. This is a great book if you have any interest in public health. I highly recommend this book. This talks about the fight among Black professionals against the idea that we were biologically inferior. And so that's a great book for you all to know about. And this book is even better. Dr. Graves is an evolutionary biologist, and he really goes into detail. It's about 25 years old. So this has not been updated with all our new epigenetic information, but still it gives you some basic understanding of some of these theories. I want to come back to Native Americans. This is Abigail Echo Hawk, one of our public health leaders in this area, working out of Seattle. And one of the biggest problems we have in medicine and public health is we don't count. It's so simple. How can you talk about disparities or inequities if you can't even count? But we don't. We don't count. We don't have information on so many groups, including Native Americans. They usually are dropped from the data. We do research, and we don't have a respect for the communities on which the research is being done. We don't have agreed upon principles for how we think about research and how we form questions. And so we really need to have a framework for research and data justice. Here's what some proposed frameworks that you can look at later. And let me end here with Sandra Galia's, presently the dean at the Boston School of Public Health, thinking about causes of death that we talked about in the very beginning. So we have this diagram. So think about what it means to have cardiology here, cancer here, liver failure. We don't list these other things, which are, in terms of order of magnitude, come close to these. I think for cardiac deaths, we're like a little over 500,600,000 a year, whatever. Why don't we list how many people die from low education? How many people die from racial segregation? These are conservative estimates of that. And so here's another thing that I think I'm almost close to the end here, that I want to make sure that we end with. This is a map that looks at voter turnout in the United States, and you can see the lighter colors. You can see where this is in the South and everything. The lighter colors have a lower turnout. The darker colors have a higher turnout. Okay, so that's one thing about civic debate. And here's life expectancy. It mirrors the same map. So is there a connection? Not a mechanical connection, but is there something that ties a low voter turnout, a low level of civic engagement, with shorter lifespans? We don't ask those questions enough. These are the final recommendations from the WHO report. You should download the report, Google it, pay attention to it, read it. Unfortunately, it hasn't changed, but they argue for what we need to do. We know what we need to do to improve population health and to close the gap on health inequities. We need to have support in early life. We need to have quality education available to everyone. You already know you only go to medical school depending on your parents' income. We need to have employment and working conditions that are safe. We need to have a safety net for when people are unemployed, housing, all these things, income distribution, race. These are the things we need to do for you all, for PNHP. We should have done this a long time ago. And the single payer will not address by itself health inequities or racism. All it does is standardize how we move money around in the medical care system. So you can look at these policy changes. Think about Paul Farmer. Any of his books will help, but we really need to be concerned about structural racism and structural murder. I like this guy, Chris Hedges, when he says I think he puts it the way it needs to be put. What's taking place today is not neglect. It's not ineptitude. It's not a policy failure. It is murder. It is murder because it's premeditated. It is murder because a conscious choice was made by the global ruling class to extinguish life rather than protect it. It is murder because profit, despite the hard statistics, the growing climate disruptions, and the scientific modeling, is deemed more important than human life and human survival. Whether we talk about oppression and power locally in the United States or places like Gaza, we have to do this as physicians. I think we have to do this as human beings, but I'm talking to people who are going to be physicians, who are going to join our profession. We have to learn and teach history in order to understand how we got here. Not just the history about the Civil War, but the history about medicine. You should know that in 1925, the diabetes was considered a Jewish disease. You should be able to understand that. You should know that, and you should understand why that came to be and how did it stop being the case. Racism is not binary. It includes everyone on the planet. Anti-Black racism, though, plays a special role historically. You have to learn to explicitly state the values you believe in. Start where you are as medical students. Understand the system that you're being trained to enter and the structures that support it. Because if you don't do that, you don't know how to dismantle the system. Understand how the issues that we may face as practicing physicians are connected to other issues. Don't be afraid to fight for a new world, a world at peace where social justice is the law of the land.